Had some interest in the story about my ear surgery, and like I said, I feel the need to talk about it and teach people about it because it's a really rare thing that happened to me, and if it goes untreated, it can potentially kill somebody. So last year, going back to last year, it was March, and I started getting a really bad ear infection, and I was going to the ear specialist, to the emergency room, to the doctor. And for 3 months, they couldn't figure out what was going on. They just threw antibiotics at me, told me to go home and try it, and just nothing was working. Well, I was so blessed to have an amazing nurse that advocated for me. So about the 3-month mark, she was like, something is horribly wrong. Like, this is not normal. We need to do something to get her help. She's been in pain for 3 months. It's making her sick. She's vomiting. She can't. Yes, I was vomiting, and I couldn't walk. It was horrible, and it was right in the middle of my 2025 Mustang training challenge, which, by the way, I still made it to after this whole ordeal. So the nurse demanded a CT scan, told the doctor, we're doing a CT scan, we have to. So I did, and it ended up being what I had, and I'm going to butcher this word, a mass. I don't know what the technical term is for it, the medical term for it is, sorry. I'll write it in the comments down below or in the description. But I had a mass growing in what's called your mastoid bone. So behind your ear you have a little bump, and it's a mastoid bone. And on the inside of that bone it looks like a sponge. And that bone is responsible for controlling the pressure in your ears. So when you go up in an airplane or over a mountain pass, or you pop your ears when you sneeze, that's what's controlling that. And in my case, most of the time when these masses grow in someone's ears, it happens when they're babies or toddlers. It's very rare for it to happen when you're an adult, but it's usually due to like a bacterial infection. And in my case, what they think happened was our bodies shed cells all of the time. Our hair, our skin, we shed cells, and usually our body will absorb what's being shed on the inside and dispose of it the proper way. Well, that wasn't happening in my case. It grew into a mass that got what they thought was mold on it, and that mass grew and grew and grew to the point where it had eaten all of the spongy material out of my mastoid bone and part of my skull. And after it ate away that spongy material and part of my skull, it started pressing on my brain. And I was hours, if not days, within this mass turning into an infection on my brain. And they took the CT scan, they sent it off to UW, which is over in Seattle, and they looked at it and they immediately scheduled me for emergency surgery that day. So I went to surgery and they got me in and they cleared out the mass. The problem with the mass is that it was so big that it had fused to my main artery, my ear canal, and my ear bones. So they couldn't get everything out the first time. So this year, I did another CT scan, and it showed that mass was continuing to grow. It's for some reason it's not stopping. The antibiotics they give me don't stop it. They have no clue what's going on. So this surgery was a little bit more invasive. They went in, took the rest of the mass out, had to reconstruct my ear canal. I have now an MRI implantable chip in my ear, which is replacing the ear bones. And then they sewed it back up and they packed it with gauze, and that's kind of where I'm at right now. I have to go in every 2 weeks to just have them look at it, and then following up in November to check my hearing to see if that is improving, and then I'll follow it up with another CT scan next year to see if anything regrows or if anything happens. Last time I went through this surgery, it wasn't as painful because the pain from the mass was so great that when I had the surgery and it was removed, it was like night and day. It was amazing. But this go around, because I didn't have the pressure of that mass causing pain, now it's just the pain of the surgery, and it was a little bit more invasive, so it's a little bit more uncomfortable than it was last year. But that's my story, and that's what I'm going through right now. So if you are somebody who is getting chronic ear infections and you feel like your head is being squeezed in a vice and you are seeing an ear specialist and they don't know what's going on, I highly suggest that you advocate for having CT scans done and having them sent to one of the very few professionals that actually know what this is. And from what I understood, from what the doctors have told me, is there's about 5 of these doctors on the West Coast that know about this and are well versed in it. Most ear, eye, throat doctors are not well versed in this because it's a rare thing. And if they are, I'm honestly surprised because a doctor I had no clue, no idea, and didn't even think to give me a CT scan. So, advocate for yourselves. Get those CT scans if you're dealing with what I've dealt with, and see if it's not something a lot more serious going on.